So, clinical condition, just now I told you. Founder of clinical homeopathy, Dr. Leon Vanier, a French homeopath, who was the first to state that in order to cure chronic disease, the treatment must address all the symptoms of the disease at once. So we have to consider the totality, that what our master has explained, totality of the symptoms. When we take the totality, then we can treat chronic disease. We must rely on clinical experience gathered by numerous homeopaths over the years. Allen, Kant, Borick, these are the legend. And they have narrated, they have given a clear-cut picture of the drug and disease. And comparing with them, we can come to the conclusion. And with that, I have developed one protocol of clinical homeopathy. It's a unique protocol which I have developed after my 42 years of experience. I take disease and its symptomatology. I always consider and I always take clinical and pathological, radiological, imaging, everything into consideration. All the investigations, all the documentations to find the deranged pathology, that where pathology has been deranged, because our duty is to restore the sick to health, to restore the abnormal pathology back to the normal physiology, means the cure. And all this analysis will give us a clear picture that here the fault is lying, here the problem is lying, and accordingly we have to select the remedy that we are treating. Now, abnormal pathology to normal physiology. That is our duty. That what our master has wrote in a first aphorism in Organon of Medicine. And this is our protocol. I follow this protocol. And with this protocol, I'm able to give quick and satisfactory result to my patient with a scientific explanation. Okay. When we are treating any condition, and when we are not able to get the desirable results in a certain span of time, we have to look for the obstacles to the cure. And what are the obstacles? Some obstacles are visible and some obstacles are invisible. We cannot see by naked eyes. And that's why we have to take a support of the investigations. So here, I want to discuss about one clinical condition, that which disease can cause anything and everything except pregnancy. Which condition can cause anything and everything except pregnancy? It is falling in a digestive disorder. Any idea? Anybody wants to give some insight, thoughts on that? If anybody wants to give any idea, then they can write in a chat box. I will happily watch it and respond it. Okay. Yes, let us remember Dr. Saville. Dr. Seville Thomas Dixon, born on 7 September 1855 at Kensington, London, UK. He wrote in his book, Seville's Medicine, which we all have studied, and he mentioned about this thing, amoebiasis, intestinal amoebiasis, an infection of the colon caused by Antimoeba histolytica. Usually it remains asymptomatic. It's anaerobic bacteria that do not live or grow when oxygen is present. So it lives and it grows in absence of oxygen. That's why it is called the anaerobic. Most commonly found in the gastrointestinal tract. When it is asymptomatic, it is considered as a commensal. But it is playing a great role in conditions such as appendicitis, diverticulitis, and perforation of the intestine. This bacteria is causing anything and everything except pregnancy, which has been mentioned in the book of medicine wrote by Seville Thomas Dixon. Let us have a look on similar condition mixed with amoebiasis, and we call it as a differential diagnosis. Differential diagnosis is very important in selection of our homeopathic remedy as well. So amoebic dysentery may be confused. The similar picture you might get with bacillary dysentery, salmonellosis, schistosomiasis, ulcerative colitis, Crohn's disease, celiac disease, IBS or IBD, irritable bowel syndrome, and eosinophilic enteritis. Non-dysenteric amoebiasis is often misdiagnosed with IBS or IBD, regional enteritis, and diverticulitis. Always, we have to do the clinical examination of the abdomen, which gives a clue that if patient get pain in the right iliac fossa, or if patient get pain in the left iliac fossa, patient get pain in the epigastrium, and whether that pain is referred back to the lumbar region. So all these clinical conditions is very, very important to come to the right diagnosis that what and with which condition patient is suffering. So here, salmonellosis, salmonella. I would like to discuss few things about salmonellosis. I had one white patient, young girl, having a pain in stomach, and that has caused intense skin rash. She was doing a horse riding, so family was thinking that because of the hair of the horse, she was developing all this. So she's allergic to horse hair. But in that case, when she was taken to the general practitioner, GP over here, then GP has referred to the consultant, dermatologist and all, and they couldn't find anything. Ultimately, they brought that young girl to me, and I took the history, and I found that she had a history, and she having a craving, desire, and sort of a routine to have a mango every day. In UK, you will get mango around the year. 365 days you will get mangoes over here. And she used to have mango. If she doesn't get the mango fruit, then she used to have a mango juice, carton juice, or mango chocolates, mango peppermints like things. So this is very important. So I found that after consumption of the mango, she is developing that rash. And immediately the Mangifera indica strike to my mind. I started administering mother tincture 10 drops to her before going for the horse riding. And within 1 week, all the rashes has been disappeared. Why I'm talking about these mangoes? Because mangoes are available in this country 365 days. And that mango is responsible for harboring, for storing the salmonella. And that salmonella was causing a sort of a skin rash to that lady, that young girl. And Similia similibus curentur, on that ground, the Mangifera indica, a medicine derived from the mango tree, it has cured that girl completely. So this is very important, that from where the source of complaints are coming. And if you consider that, then there is no need of taking a very deep history, but history is very, very important. That gives a clue that how it has been affecting the patient's condition. So now we are going again back to the symptoms of intestinal amoebiasis. So it has been said by several that it can cause anything and everything except pregnancy, intermittent diarrhea and constipation, flatulence, cramps, foul-smelling flatus, stool mixed with mucus, initially, later on with the blood, when ulcer gets bigger and bigger, and on examination, tenderness over the right hypochondrium, ascending colon, and then it becomes the whole abdomen becomes sensitive, and that is called tympanitis. Okay, now how we have to diagnose this clinical condition? So serologically, we can advise patient for a blood test, that amoebic antibodies by ELISA, enzyme-linked immunoassay. It shows a typical amount of amoebic antibodies in the blood. Another is PCR, polymer chain reaction. That also shows the presence of amoebic protein, the protein of that amoebic cell, the cell protein that comes in that, and stool test. It may require 3 to 6 samples, because initially in one sample, it will not come positive, and sometimes some antibiotic, some antidiarrheal agents, enemas, radio contrast interfere, and it covers the whole amoebic cell, and that's why it doesn't come positive. So many times, one sample will not reveal. We have to centrifuge that sample to see the clear-cut amoebic infection. And for hepatic amoebiasis, we have advised patient to undergo a liver function test. Clinical examination, tenderness on the liver, and hepatic amoebiasis is always presenting patient's appetite. Patient doesn't feel hungry. Patient with a small amount of food, patient feel bloated. So these are the differentiation. Okay, now homeopathic approach in repertory with the digestive disorder, and especially with the amoebiasis. So colitis means inflammation of the colon. Mercor, if we look at the symptoms of the mercor, then dysentery, tenesmus, not relieved by stool, shreds of mucous membrane, presence in stool. Gambogia, Garcinia morella, sudden and forcible ejection of bilious stool. As soon as patient goes to the toilet, stool comes as if it is exploding. And recently I'm treating one patient. That patient was complaining that as if I feel that bomb has blasted in a commode and my stool spreads everywhere. After that, I pass only mucus. So this is very important. I have given Mercor to that patient. Patient is feeling a bit better. Ignatia, painful constriction of the sphincter of the stool. This is very important. Painful contraction, the sphincter after stool. Pressure as if a sharp instrument from within onward. Diarrhea from fright. Ignatia patient having a always suppression of the emotions. Patient is always nervous. Patient is always anticipating the things in a different way. And with that, that fright is making sick, that fright is making the patient to secrete more adrenaline. With the secretion of more adrenaline, patient having a more frequency to go to the toilet. Patient is getting panic. So this is a typical ignatia picture. And MAC self, Epsom salt. Eructations tasting like bad egg, effect on intestinal peristalsis, causing rush of fluid in the intestine, producing a distension of the bowel, produces evacuation. MAC for showing a borborygmus, loud rumbling. The patient is sitting at least 3-4 feet away from you. Then also you can hear that borborygmus, that gurgling in patient's stomach in MAC self patient. Argentum nitricum is another very good remedy for digestion disorder. And with the amoebiasis, patient is always passing mucus in the stool. And if we consider the rubric stool mucus, these are the remedies. Yes. Stool, mucus with abdominal pain, viola tricolor. Mucus is acrid, then phosphorus. Mucus alternating with constipation, then aconite and ruta. Mucus with bloody black stool, then capsicum. Mucus with bloody chronic 2 years, 3 years, 4 years, like chronicity, then Trillium pendulum with colic and chilliness, copavia, copious terebinthina, covered with mucus graphitis. Graphite is very good remedy for ulcerative colitis, mucus colitis. Involuntary, patient cannot control the stool. As soon as patient develop the urge, patient has to rush to the toilet. That is solidago. Jelly-like, Asarum europeum and colchicum. Mucus mixed with liquid, that is alumina. Alumina also having a tendency to develop all the digestive problem with the potatoes. Borax and carbamide. When mucus mixed with liquid, lumpy mucus, prostox, lumpy mucus, arsenicum album, lumpy mucus, yellow, lumpy mucus, graphitis, but along with that, not only mucus, setinaceous, thread-like mucus, and it is very offensive. One of my patients was complaining that when my wife goes to the toilet and immediately if I have to use the toilet, I cannot, because that toilet smells like a hell. And this is a very, very important symptoms which has been given by the patient's husband. So sometimes this type of input from the family members gives very good insight for us to select the right remedy. So remedies to treat amoebiasis. Arsenicum album, master medicine. What arsenicum album picture shows amoebic patient having amoebiasis, how arsenicum album represent that patient. It is a small, offensive, dark with much prostration. Patient gets tired, exhausted, worse at night and after eating and drinking. From chilling stomach, alcoholic abuse, spoiled meat, dysentery, dark, bloody, very offensive, bloody, cold as ice. Arsenicum album is a very good remedy for the micro food poisoning. When patient complains or when patient gives a history that we have been to the restaurant and after 2 days, My stomach has started showing some abnormal symptoms like passage of mucus, frequency of stool has been increased, I'm getting some colic, pain, very bad irritations. At that time, arsenic alb is the right remedy to overcome and to cure the micro food poisoning. When patient is passing a gas, flatus is very offensive. Sometimes with the passage of flatus, patient may come or patient may complain that I'm meeting up in an accident. So there is a leaking, incontinence of the stool is also there with the micro food poisoning. Imetinum, an alkaloid from Epica. Epica is the greatest homeopathic anti-amoebic. When amoebiasis takes place in the intestine, patient feel nauseous. Patients feel bitter taste in the mouth. Patient feels bloated. Patient gets passage of mucus. Even in female patients, they are complaining about leukorrhea. And sometimes amoebiasis is also associated with giardiasis. Spoiled meat is one of the factor. Unwashed vegetable is one of the factor. Unhygienic food from the restaurant or unhygienic food served by the waiters from the hotel, from the restaurant is one of the factors. Those are the factors which gives us a clear-cut clue that patient having a complaint of amoebiasis. So we have seen about the arsenicum album, imetinum, and tuberculinum bovinum, that what we are discussing, that is painful constipation. With the amoebiasis, there are two bacteria is participating. One is E. histiolytica, Antimoeba histiolytica, and another one is Antimoeba hartmanni, E. hartmanni. E. histiolytica is always causing diarrhea and passage of mucus, but E. hartmanni is always responsible to cause constipation. And sometimes that mixed infection is always causing diarrhea and constipation alternating. So tuberculinum bovinum can't painful constipation. So we have to think about E. hartmanni, recurrent diarrhea, and aggravation by early morning. As soon as patient opens eye, patient has to rush to the toilet. You can't stop. So this is all about the picture of intestinal amoebiasis, and we can imagine how widespread common condition causing confusion with digestive disorder. When patient comes at, oh, I am the stomach upset, if we go in all these details, then we can come to the right diagnosis that what patient having this amoebic infection. And this is the real obstacles to the cure. Because when this amoebiasis, when this amoeba dies inside, after a certain period of the time, it leaves another 4 eggs. That 4 egg multiplies by 4 into 4, that is 16. That multiplies 16 into 16. And all the dead cell, the protein of the dead cell, it comes into the general circulation. With that, majority of the patient find itching all over the body randomly. There is no any specific or particular time about the itching, and patient itches. If you advise patient to do the routine full blood count, you will be able to see the higher level of higher number of eosinophil. So eosinophilia, absolute eosinophil count is very, very high. You can treat that high eosinophil with the help of natrum sulph. It's a liver remedy. It also cures the hepatic amoebiasis. It also cures the allergic focus, which has been produced by the cell membrane of the dead amoebiasis, and patient gets better very soon. And you cure your patient from the chronic illness which he is going to meet if the amoebiasis is left untreated. So this all about my thoughts on the obstacles to the cure, digestive disorder, where the latent cause is lying in the intestine, but which cannot be visible unless and until you go in depth of the history taking, and if you go in a detailed investigations. Hope you have enjoyed the presentation, and yes, now I'm concluding my talk. This is all about my books, and I am highly thankful to IFPH for giving me an opportunity to share my thoughts, and really, I'm very much delighted, and really I enjoyed to share my views